jugular vein. The jugular vein, most of the arteries, with some exceptions, have veins that run with them that have the same names. The jugular vein is not one of those. It runs with the carotid arteries. Carotid meaning to put to sleep. If you're like me and you like to watch and listen to graphic, violent things sometimes, well, not really violent, but because some of that you can't unhear once you've heard it. It means to put to sleep. When they go and they decide they're going to strangle somebody or at least try to make them unconscious for long enough for them to get away, they squeeze on that artery and they go to sleep, carotid artery. It's the common carotid artery until it splits. Common meaning that it splits. Once it splits, the internal artery is going to go towards the cranium. The external artery is going to go towards the face. Once the external carotid artery goes towards the face and is lining the anterior surface of the skull, it's the facial artery. It runs with the facial vein. Just think it's running on the face, it's a facial artery. Right here, this artery right here is the superficial temporal artery. You guys remember where the temporal bone is? Right here. Right here. The superficial temporal artery, meaning it's running right over the superficial surface, right there. And it runs with the superficial vein. The right and left brachiocephalic veins are these right here. Once they move behind the clavicle, they're the subclavian veins and arteries. Sub meaning behind, clavian meaning clavicle. They run behind the clavicle. Subclavian artery and vein. As they pass down and they continue to move down the arm, when they pass right next to the armpit area, they're now the axillary artery and vein. As they move down the arm, they're the brachial artery and vein. Excuse me, yeah, brachial artery and vein. On this side, brachial artery and vein. As they move down the upper arm, they're going to split. And the radial artery is going to run down the side of the radius. And the ulnar artery is going to run down the side of the ulna. There are radial veins and ulnar veins, but on the model you cannot distinguish them from the cephalic and the basilic veins. So we're just going to worry about the cephalic veins and the basilic veins. The cephalic vein is on the lateral surface of the arm. The basilic vein is on the medial surface of the arm. They merge to form the median cubital that runs on the anterior surface of the elbow. If you remember what cubital meant, cubital meaning elbow, median meaning the middle, the median cubital vein. This is where they tend to draw blood from. The way you know the cephalic from the basilic, you guys, cephalic meaning head or top. If I'm standing in an anatomical position, my cephalic artery is on top of my basilic. Brachiocephalic trunk is this artery right here. Actually, okay, so we talked about the arteries and veins of the head and the arm. Coming back here, the three main arteries that are coming off the aortic arch, the brachiocephalic trunk, the left common carotid, and the left subclavian. Moving down, once the aorta passes the diaphragm, it becomes the abdominal aorta in the abdominal cavity. So coming down, on the abdominal aorta, there are three unpaired arteries where there isn't a left or a right. There are three unpaired arteries. The first one is the celiac trunk. Right after the aorta passes through the diaphragm is the celiac trunk. The celiac trunk has three main branches come off it. The common hepatic meaning liver, so common hepatic going towards the liver. Meaning common meaning it's going to split. The left gastric going towards the left side and doing the stomach, because gastric meaning stomach. And the spleen right here, the splenic artery. So three branches off the celiac trunk, the common hepatic, left gastric, and splenic artery. Moving further down, as the renal vein is going to cross over the anterior surface of the aorta, is the superior mesenteric artery. Right underneath it, and it's would be shown about right there, is the inferior mesenteric artery. Mesentery meaning more like the intestinal region. Superior mesenteric doing the superior region, inferior mesenteric doing the inferior region of the intestinal region. All of these, except for the common hepatic, have veins that run with them. So, moving further down, my hepatic artery coming off the aorta, hepatic veins run with them. Hepatic portal, you don't see it on this one, but you guys almost always, it looks purple. I always think portal purple. It is where all of the blood from the superior mesenteric, the inferior mesenteric veins, and the splenic vein, they all merge together to form the hepatic portal vein which is going to take the blood that's coming from the spleen and the intestinal regions and move it through the liver before that blood returns to the heart, and allow the liver to clean it up and detoxify it. Okay, coming down further. Once the abdominal aorta splits, it forms the common iliac. If you remember from what you learned like the first week of AMP1 lab, this area right here is called the iliac region. This is the common iliac artery. It splits into the internal iliac arteries that are going to supply the organs in the pelvic cavity, and the external iliac artery that runs down the anterior medial surface of the leg. As the external iliac artery runs down, it becomes the femoral artery. As the femoral artery runs down, it's going to go behind the knee and be the popliteal artery. You guys, there's veins that run with all of these. Once the popliteal artery continues down the leg, it's going to form the posterior tibial artery and the anterior tibial artery. As the anterior tibial artery goes down onto the foot, it becomes the dorsal pediis artery. You guys, the best way to think of the dorsal pediis is, we know what dorsal means, dorsal meaning the back. You guys, when you look down at your foot, that is the dorsal side of your foot. If you think about it, this is the dorsal side of my hand. It's got my fingernails on it. If I look down at my foot, what I'm looking at is my toenails first, right? That has to be the dorsal side of my foot then. Pedis meaning foot. Dorsal pedis meaning the artery that runs on the back of your foot, which is what you're looking at. Two major veins on the leg that don't run with any arteries. The great saphenous vein runs all the way. Small saphenous vein on the other side. Great saphenous vein is the most superficial and longest vein you have in your body. It is a pain in the butt to try to dissect out on a cadaver because it's so superficial and flimsy. I have never been able to do it and not cut it in the process. The small saphenous on the other side. So medial side of the leg, great saphenous. Lateral lower leg, small saphenous. You guys, I think that's it.